Fluid therapy can be used to treat various illnesses, assist in stabilization, and help recover emergency and critical care patients. Some indications for fluid therapy are to replace hydration deficits, which can happen from patients with ongoing losses such as vomiting, diarrhea, or patients that are anorexic or polyuric. It can also be used to help hypotensive or hypovolemic patients who have a reduced vascular tone due to anesthetic drugs. It's also used for electrolyte replacement. To replace sodium, chloride, potassium are just a few examples that fluid therapy can help. To maintain acid-base balance, to help in diuresis, so to promote urine output, which can help the kidneys, liver, or patients who have gotten into something poisonous. It can also be used for IV administration for a vehicle to infuse medications. Total body water accounts for approximately 60% of the patient's body weight. The fluid is broken down in intracellular fluid, which is 40% of body weight or 2/3, and extracellular fluid constitutes for 20%, which is further divided into 5% plasma and 15% interstitial.
Okay, so ways to remember the differences between hypotonic, hypertonic, and isotonic solutions are, with hypotonic, you think of the water going into the cell, making it larger like a hippo, and you would use hypotonic solutions with patients that have congestive heart failure because they're more predisposed to retaining sodium. And then with hypertonic solutions, you would think of a person that's really hyper and skinny, and so the fluid is going outside of the cell, making the cell skinny. And you would use this type of fluid with a patient that had a head trauma or cerebral edema because it's really good at pulling the fluids away from that area. And then isotonic solutions are just the normal maintenance fluids that you would use in rapid volume expansion. So colloids are another type of fluids that we can use. The difference between crystalloids and colloids are that colloids have a high molecular weight and substances that do not pass readily across capillary membranes. They are also negatively charged, and their presence in the vasculature pulls water from the interstitium to help re-expand and fix damaged vessels. So there's two different types of colloids. The synthetics are heterostratics, volumen, and oxyhemoglobin. And then our natural versions of colloids are whole blood, fresh frozen plasma, and albumin.
Patient assessment is needed to create a proper fluid therapy regimen. So we can assess the patient's hydration status a couple of ways: by getting their body weight and comparing it to what their normal baseline body weight is, by doing the skin turgor, which is holding up a flap of their skin and letting it fall down and seeing how long it takes for it to go back down. The next one is their mucous membrane color. So we look inside their mouth. We can look at their other mucous membranes as well, but this is the most popular one, and see if it's dry or tacky. That means that they are dehydrated, and we want their capillary refill time to be less than 2 seconds, because that's also a good indicator of perfusion. We can also do their baseline labs, such as PCV, total protein, and urine-specific gravity, to get a better hydration status in their blood.
To set up your IV fluid pump for your patient to receive fluids, there's a couple things you'll need. First, you will need your fluid pump, which will help infuse the fluids. Then you'll need to decide whether you need a macro drip set versus a micro drip set, depending on your patient's weight, and then you will use your fluids of choice. To prep your IV line to be ready to use, first you'll need to unwrap your IV line, making sure it's the correct one for your patient, and then as sterilely as possible, you're going to switch the drip sets without touching any of the parts that go inside of the fluid bag. And then once you have your spike in, you're going to clamp off to fill up the chamber so you can prime the line without any air bubbles. So you squeeze the chamber once or twice to fill it up, and then release your clamp and watch your fluid go through your line, making sure there are no air bubbles following. And once it reaches the hub, you could put your clamp on, and then you're ready to go into the pump. We have our fluid pump set at 29 mils per hour, and we have it set on macro because that is the type of line we will be using. So what you want to do is place your fluid line in the direction that it flows through the pump, shut the door, and then you're going to want to set the time that you want your fluids to be running. You're also going to want to clear the volume that has been infused in a previous patient that was using this pump, and then you'll hit run. Then you'll turn off your pump and unclamp everything, making sure that you won't get any high pressure or air messages on your pump when it's hooked up to your patient. Once everything's unclamped and good to go, then you are ready to hook it up to your patient. There are a couple different ways to administer fluids. You can do it subcutaneously, intravenously, intraosseous. This is a rabbit that came into my clinic that hadn't been eating for 4 days. So the doctor ordered to give 20 mils of normal salt R subcutaneously. I put it in a syringe and ran it under warm water to make sure they were warm for the rabbit. Some advantages of subcutaneous fluids would be that they're easy to administer. You would use them in smaller animals. Owners can do it at home, and it's relatively cost effective in comparison to hospitalizing your patient. This is a cat that came into the clinic to receive 100 mils of sub-Q fluids. To administer the fluids, you will first want to tent the skin to have access to the sub-Q space, and then you will place your needle bevel up underneath the skin. Once you are underneath the skin, you will hold the needle in place with your hands while unclamping your fluid bag to let it run. When you are done administering the fluids, you should see a nice bubble of fluids underneath the skin. It's also good to let owners know that this is a normal part of the process and should be resolved within a couple of hours.